Come on in. Hi, nice to meet you.
And you?
So where do you work at the moment then?
Southmead. I've just come off a night shift.
Oh, bad.
I'm
Poor
still
you.
in scrubs.
Poor you.
Yeah.
What are you doing at the moment?
Well, cardiology, but I'm only F1, so
Right.
4-month rotations, so it's not specialised or anything.
And how is it going? Are you enjoying it? Is it?
Sometimes. I think overall I'm enjoying it, but it's the on-calls can be quite bad.
Sure. I
Yeah.
did that job many years ago, and it's probably not changed at all in 10 years. But what are we talking about today? What do we need to sort out?
Basically, my urine infections. I've had a lot in the last year,
Right.
and then it was a little while before I had it again. But then last week, or potentially the week before that, I had another urine infection.
Right. So how many had you had beforehand? Was that something that you'd had?
Yeah, so in the last year and a bit, I've had probably 10, 9, yeah, something like that.
Yeah,
Not all
so
of
that's
them.
a lot, isn't it?
Yeah.
Sure. So that
Yeah.
was the decision then to start you on a medicine to try and stop them from
Yes.
coming.
It did seem to work for a bit,
Yeah.
and then
have you just had one since you've stopped it again?
yes,
And that was, which month did you stop it?
maybe March.
Okay. So you had a sort of 1 to 2 month window where you didn't get any, and then you've had them again.
In the
just
one,
recently.
yeah.
And I mean, from my point of view, it seems very reasonable if you're getting them roughly 1 per month to take a tablet every day to try and stop that
Yeah,
happening.
I'm hoping.
So I'm very happy to get that restarted for you. It's complicated because, of course, we don't want to be creating resistance to bugs.
No, I know.
But on the other hand, if you're taking a lot of antibiotics because you keep getting infections, then you're using quite a lot of antibiotics anyway.
Yeah.
Hopefully, this should mean that we don't need to worry about it in the future. But we'll have to wait and see. So obviously, you can play that one by ear. Good. So those have all gone to the chemist next door. Hope you get some sleep.
Yes, well, it's the last day, so I'm going to
Oh, yeah, so you're going to try and stay up.
Yeah. I always hate that day.
I know.
Okay, cool.
Nice
All
to
right.
see you.
Thank you.
Bye.
Bye.
I'm Dr. Ahmed. We're just
Hi.
going right to the end.
I think when I came to this clinic, I was assigned to you as my...
That's right. You're
But I did
registered
see
with
someone
me.
else the other day, so...
We tend to follow personal lists. What that means is that tend to see the same person.
Okay.
You can see them, you can change if you get fed up with them. So that both sides get to know each other.
Yeah.
It just makes it a bit easier. What's on your mind today?
Strange issue when I do exercise.
Okay.
So if I run, I can jog for about 4 or 5 minutes, and then very quickly, within about 5-10 seconds, I get this feeling of just like I'm going to faint or something. I get dizzy, and it sort of feels like it's here, but not really a breathing thing. I can't work out what it is, and I just stop. I can't force myself to run because obviously your body's trying to say, whoa. So I sort of stop, and if I stop, I just need 30 seconds, and then I can run again for about 3 minutes, and then it comes again. So it's like it builds up. It just...
So you can run for how long?
I did about 2 kilometres. I feel like, my head, like I'm almost going to faint. I just feel lightheaded.
But you don't actually pass out?
No,
I think.
not at all.
And any tightness in your chest, or any pain in your jaw or arms or anything? Leg pains or anything? And this has been going on for how long?
Probably 8 months or something.
About 8 months?
Yeah.
Okay.
And I've always had very low pulse.
Okay.
So sometimes doctors have gone, and I've just gone for medical or something. I work in the mining industry, so I'm always having medicals. And there's some that go, wow, do you feel faint, because I'm on 40-something or...
Right.
And I feel absolutely fine.
You feel fine, that's your standard. Okay. I might just check you over, is that okay?
Yep.
So let's just put that on here. Okay, just breathe normally. I'm just going to listen to the heart. That's fine. Pop your things on. Come and take a seat. All sounds all right in there. So I think something's going on that's changed in the last 8 months or so. So we need to look into it and check it out. So the first thing we're going to do is check some blood tests, including checking your cholesterol, your sugar level, your thyroid function. I'd also like to get a baseline ECG or heart recording. It goes without saying, at any point if there's shortness of breath or palpitation or chest pain, straight to A&E for a check over. I don't know if your pulse is varying when you're exercising and you're getting some kind of change in rhythm.
Yeah.
We might also have to put a heart monitor on for 24 hours or maybe 7 days, which is a bit of a pain, but, you know...
I had
it's
one
a
once
change.
after the
low pulse?
malaria.
Oh, after the malaria, okay.
Yeah, I seem to have some weird issue.
And the malaria was when?
That was a long time ago, like 15 years, 20 years.
15, 20 years.
And then dengue was about a year ago.
So that
And I was quite ill, so I was medevaced from Sri Lanka to Singapore.
Okay.
I was quite ill for a day or two, didn't really know what was going on, and they were quite concerned.
And malaria you contracted where?
I had it twice, Mozambique and
Okay.
Ghana. Mozambique, I was very ill as well.
Okay.
They thought I actually was going to make it.
Right, okay.
Because I was stuck in a bush camp.
Yeah,
My
yeah,
temperature
yeah.
was like 42.
You've been through a bit, haven't you?
Yeah.
So I'll have a check on those because obviously we don't come across tropical diseases
Yeah.
very often to see if there's any long-term sequelae from any of those. But let's do the basics first. We'll check you over and see. So if I give you that, I'll just show
So
you
that's
the
a booking for
treatments.
ECG thing, is it? Oh,
Yes.
yeah, okay.
If you go to main reception, they'll sort you out, and then I'll take it from there.
Okay, excellent, thank you.
I'll be in touch. Take care.
Okay, see you.
Thanks,
Thanks.
bye.
Come on in. Come and have a seat. So if I could put you there. So this is Dr. Leslie Black, who's just joined us. Right, so what can we do for you?
I keep feeling really sick all the time. I have no energy whatsoever, and it's just driving me mad at the sickness feeling. I have been sick a few times, and if I'm not sick, it tends to just give me a really bad stomachache, and it just feels like everything's stuck and won't digest, and it just wants to come straight back up again. And it's been going on for about 3 weeks now. And we went out for some food last week. I only had a ciabatta and I felt so ill afterwards. So I've just been sticking to sort of squash, water, tea and fruit and salads. I just want a nice roast dinner and not feel sick.
3 weeks is a bit long, isn't it? It's gone on
Yeah,
too long now.
yeah.
So I'm going to get you
course.
to lie over here. Let's
Okay.
examine your tummy.
All right,
Have you had blood tests done or anything?
No, not recently.
Okay.
Well, not recently, no.
I'm just going to listen to it for a minute.
Okay. Makes me feel really sick when it just, sorry.
Well, it's very overactive. There's a lot of noise in there.
Okay.
Let me just take your pulse and things. It's a very nice, steady
I just
pulse.
feel really...
Yes, I can see you do. You can see it in your face, actually.
I just don't seem to have any stamina. Obviously, I know when you don't eat enough, you know, you can feel a little bit weak and stuff, but...
So we need to do some tests.
Okay.
Start with some blood tests. If we do those now, we'll get them back tomorrow, most of them, and then decide when we see what your
Yeah,
blood
that's
shows, what other tests you should have.
Okay.
Leslie, can I
Yeah, of
ask you to do this? I'm sorry not to show
That's
you.
fine. Right, let me wash my hands.
So I'm going to do full blood count.
Okay.
I'll do a celiac screen while I'm about it. But I want to do a bone profile. Anything else you would suggest?
TFTs?
Oh, yeah, because you're tired as well. Oh, we'll do a
I'm feeling a bit
hemoglobin.
hot.
Yes, of course. We'll do those things.
Okay. I love taking blood, but I don't like blood quality.
I know. Do you know I'm the same?
Very good. I'll ring you tomorrow.
Okay.
Is that all right?
Yeah, that's absolutely fine.
Okay. Is that all right? That's a bit worrying, don't you think?
It's not quite right, is it?
Not quite right, and she felt very sick when I pressed here. I couldn't feel her mass.
Whereabouts was it?
Just over descending, but not at the
Okay.
bottom. So if she's got anemia, 2-week wait in tomorrow for the endoscopy. We'll do a colonoscopy.
Okay.
If she's anemic, we do both actually,
Yeah, okay.
because I'm worried about her.
Yeah, definitely.
Come and have a seat. Now, what do we need to talk about?
I came in some time, well, a little while back.
Yep.
Right, my shoulder, my arm.
This was in April when you saw Dr. Ramshaw?
Yes.
Yes.
I had X-ray and some ultrasonic sounds
Okay.
on it. A course of tablets and cream. I would say is getting a bit worse than better.
Right. And I haven't read all the notes, sorry, because I was running a bit behind. Do you mind if I just have a look
Yes.
through it and see? So, good news on the ultrasound scan. And the shoulder joint they report as normal as well. So we've done the 2 relevant tests, and neither of them have really given us an answer. Can I just examine you now myself?
Yes, that's not
yeah.
yeah.
So if you just stand up, if I take the weight of this arm now and I try and lift it, it won't go. No. Okay. Because it's blocked or because it's too painful?
Too painful.
All right, have a sit back now. So this looks like a condition called frozen shoulder.
Right, OK.
So the 2 things I think that you've not had are a steroid injection into the shoulder, OK, and physiotherapy. Now, the good news is that frozen shoulder does resolve over time. Do you want me to do a steroid injection now, or do you want to think about it? Or?
I'll do anything just to see what, if it fixes it.
Yes. OK. So it's steroid mixed in with local anaesthetic, OK? Usually it's not particularly uncomfortable. Occasionally it is. I'm sorry if that's the case, but usually it isn't too bad. Don't expect that there'll be a miraculous result. I mean, you may find it's more comfortable for several hours because of the local anaesthetic, and then that will wear off, and then you'll be back to normal. There's always a theoretical risk of infection getting into the joint, which is bad news if that happens. The risk of that is about 1 in 2,000, I believe. I've never seen it happen, so I don't think there's any particular reason why it should happen to you, OK? Now, actually, you'll need to take your shirt off, so if you do that. Great. Stand up. So there's a prick coming up now, all right? I'm putting in more local anaesthetic than I would normally use in this situation. I'm just trying to distend things within the joint a little bit. Is that OK?
Yeah.
Not uncomfortable?
That's OK.
Sorry, yeah. OK, do you want to pop your shirt back on? Just give that arm a little bit of a move around, actually. So if you try and do some of those movements we did before. Yeah, OK. And we'll try and get some physio for you as soon as possible, OK? Any problems after injection, let us know.
Right, thank you very much.
OK, all right.
Thank you.
Cheers.
Thank you.
Come and have a seat.
Thank you very much. Thank you.
So I'm Dr. Liz Lee. I don't think we've met before,
No, I
have
don't
we?
think we have. No.
OK.
I had a mental health assessment last week, and I had a letter which was about the extra tablet that they suggested.
Yes, Tom Pelly has just written a note, so...
I think it was Miss Dr. Pelly
Have you
that...
got it there?
Yes, I have. Yeah, it's the last section.
There we are. So are you happy with this plan? Did you share on that meeting?
Yeah. It's just that I have real difficulty going out and like in social places, town and stuff, just because I feel people are laughing at me, and it's got worse. And I had the assessment, and she said it obviously wasn't a magic cure, but hopefully it would help.
Has this been a long time, this problem?
Yeah, I've had it for a long time. I do all the, no, they can't be laughing at me.
Yes.
You know,
have you done CBT? Have you done some sort of...
I've done DBT.
OK.
But not CBT.
What's DBT?
It's dialectical behavioural therapy, and it's to do with your emotions, kind of challenging some of the things that you think. So say I was feeling that people were laughing at me, it would be like, well, you know, they might be laughing at a joke or laughing at something they've just seen, not necessarily me, but when I'm out, it's really hard to get that in. And also it involves mindfulness as well.
That's great, actually. Because I think we all know that feeling of they're talking about me, but actually they're not talking about me at all. I'm nowhere in their thoughts. But what I expect they hope is that this will just calm things down a bit, and the new one that they're going to give, so that then you can use your DBT training more powerfully and begin to sort of actually convince yourself of the truth.
Yeah.
Michelle suffers from social anxiety, and actually this is a really common problem. It's one of the real drivers for the illness agoraphobia, where people just don't want to leave the house at all. We then have to talk about ways of addressing this problem of a false perception, because in fact people aren't talking about Michelle or laughing about her. She just thinks they are. So with DBT, the therapist will work with the patient to try and get them to accept who they are and not constantly be fighting their own personality. And then as a result of that, small changes in behaviour can be encouraged and made, and this makes a great difference to your interaction with the wider world. In fact, you're my second patient today who's got this problem. And what's impressive about both of you is you've managed to come and sit by yourself in the waiting room, which is quite difficult to do, isn't it?
Yeah.
And to come in by yourself. So obviously you're making some progress. Great. So consider adding this other drug called pregabalin. What did you feel about that?
I guess I would be anxious to start it.
Okay.
Yeah.
Right. The talking therapies and medication both work by themselves, but the medication works to settle some of the disabling anxiety, and that allows you to focus more on the quite difficult work that's required if you're going to undertake CBT or DBT. Do you live by yourself?
I do, yeah.
So you haven't got anyone to push you out in the door?
I've got a dog, actually.
Oh, that does work. That's good.
Over the years, I've probably walked a lot more than if I didn't have him.
Yeah. Great, good. Listen, this says for general anxiety disorder, you take 50 milligrams up to 3 times a day. So they also, this warning says that if you're taking anti-epileptic drugs, well, Tegretol you take.
I do, yeah.
Very occasionally, the combination of the 2 drugs can make you feel really bad in the first week.
OK.
So I'm just warning you, if you suddenly feel suicidal thoughts coming up. I mean, do you have those sorts of thoughts anyway?
Not so much as I used to, and I feel pretty certain that I wouldn't act on them because I have my dog.
Good.
I wouldn't leave my dog.
No, you mustn't leave your dog.
No.
Great. Nice to meet you.
Lovely. Thank you very much. Nice to meet you.
And you. Very good. Good luck with it all.
Yeah, thank you.
And you just let us know if you get worse.
I will.
All right.
Yeah, thank you very much.
Bye.
Bye-bye.
Come and take a seat.
Thank you, love.
I'm a little bit worried about what's going on with you a little bit, because over the weekend you had this hypoglycemia, or your sugars went a bit low.
Yeah, it went right down, yeah. And lucky I collapsed on a settee, like, you know what I mean? But it's my fault because I wasn't eating.
But why weren't you eating?
I don't know, I just, you know, it was all the worry, I keep going up there and all this nonsense, and, you know, getting on my nerves.
Yeah. Are you vomiting up food?
No.
Because you said to one of my colleagues...
I was just sick. We still look upset. That was all, just getting now and again.
So when you eat your food, it's going down okay?
Yeah.
Okay.
I've lost some weight, man.
Yeah, you have. Are your bowels working normally?
Yes.
No blood when you go?
No blood at all.
Mm.
And I always I'll check this because it's for a reason, like, you know, when I go to college in July, they say, I said, well, where am I bleeding? I can't understand. I got this camera down there and it's all clear, like, you know.
You've had the bowel check last year, and we don't need to repeat it. But last year you also had the camera test, which showed,
twice.
you know, a stricture. So what happened was that there was a tightening in your food pipe, and then when they repeated it, that had cleared up.
Yeah, that's right.
I'm wondering if that's reoccurred again. How do you feel about if we just repeated the camera test?
I don't really want it.
To double check?
Because I keep going out there all the time and it's doing my head in, like, you know.
I know.
I got this morning.
Because of the foot, haven't you? I know.
It's just doing my head in. Keep going up there all the time, and it's get right on top of me.
Because what I would like to do is, I'm wondering why your blood count has dropped. You see, I don't know if you're losing blood from somewhere. That's the only reason. One thing that would be good is if we could do a wee sample, and
I'll bring it in tomorrow.
That's fine.
Okay.
And we'll probably do a blood test, but not today.
All right.
We'll do it towards the end of the week just to see what's happening.
Okay.
I've also referred you back to the blood specialist, but I don't know if you've had an appointment through.
No, I haven't. No.
Okay.
Well, I say, I was wondering if I had cancer come back again, like, no, but they would have found that by now, wouldn't they, surely?
What if I wanted to organise a scan whereby you lie in one of those tube things and they do a scan, an X-ray of this bit off you?
Out there?
Yeah. How would you feel about that?
I suppose.
You'd be okay with that, would you? It's not as invasive as having a, you know, because I think I need something to work out what's going on.
Do that then, my love. There's a party next Tuesday down in Western Supermare. I've been invited down, so I'm going to go down there for a day out. I'm alive. I've just got to get away, like, you know what I mean? I'm gonna
have a break.
Yeah, I'm going to have a drink.
Not too much.
No, but, well, I'm going to have a drink. And I'm going to take some sandwiches with me. I'm going to spoil myself for that.
All right. Well, I think you do deserve your own treat, but if you're happy for me to scan you...
Yeah, I will do.
I'll do that.
All right, my love.
All right.
Yeah.
Thanks for coming in. I'll come out with you, because I've got to call the next person in.
All right, then scan.
OK.
Yeah.
Brought reinforcements?
I have, yes. She brought me down.
Do you want to take that seat there? Yeah. So, you family or friend or sister? OK. All right. So we've got some blood results to discuss, haven't we? Can I just go through the background first of all?
Yeah.
You asked Pete in the pharmacy to do your blood test, or he
offered to do the. He offered because I was a bit concerned.
Getting very thirsty, was that?
Dry mouth. Very dry mouth. But it's just carried on.
And how long has that been going on for?
It's quite a few weeks now.
And by drinking a lot, give me an idea how much you've been drinking.
Glass after glass.
Glass after glass after glass.
Glass after glass.
OK.
Yes.
And mainly water, or?
No, fizzy, juice.
OK.
And that.
Something with sugar in or not?
Probably, yes.
So weight, first of all, has that changed in
yes,
any
it
way?
has, because
In what way has it changed?
I've been off of work for over a year now because of I had bleed on the brain. And my mobility was severely...
So you put weight on, have you?
And I have put weight on.
OK. Do you think she's changed at all? Lost weight, gained weight?
I would say gain.
Gained some weight. OK.
Around, especially.
It's the middle, especially around the middle.
Have you had any thrush recently? So
no.
Dry or sore mouth or white down below?
My mouth seems to feel like it's on fire sometimes, but other than that, no.
Okay. So you wondered if you had diabetes, obviously, from what we said
just checking the sugar level, really, that was all.
Pete did a blood test which was high, the sugar level, and we've done blood tests now, and they point the same way, really. So, so yes, I think I have to say you do have diabetes, actually.
Right, OK. Yeah.
So that's not a complete surprise to you?
It runs in the family.
When you say it's in the family, what do you know about it?
All I know is raised sugar levels and it needs to be controlled. My father had to inject.
OK.
My uncle's got it. My grandmother had it as well. Okay. And I know the consequences is your feet, losing the feeling in your feet.
OK.
And your nerve endings.
Yes, that
something like that. Yeah. And your eyesight, is it cataracts? Glaucoma, that's...
Well, it can cause various things to do with the eye. Glaucoma wouldn't be the commonest, but when you've got type 2 diabetes, which is what I'm sure you've got, there's a problem with the way that the body handles the sugars that have come from your diet. Okay?
I'm feeling a bit more tired.
So you can feel tired, you can feel very thirsty, all sorts of things. Yeah. So next thing is we need to look at your diet, OK? And I will get the treatment room nurses to have a look at your diet with you. And we almost certainly are going to need to get you onto some form of medication to lower the blood sugar. So I'll print off some information sheets. I'm going to book an appointment with the nurses. They will give you a long appointment to go through all this with you, and then we'll take it from there. Okay.
Right.
Okay.
Yep.
All right. Well done.
Come on in. How are you?
Knee was 3 times its normal size.
Oh no!
Through part of last week and right up until Sunday. It's going down a bit now.
Oh my gosh!
It's so painful. I presume it's arthritis. If you look now, you can see that it's not normal.
No.
And the pain is around there, through the back. I've been rubbing some of the deep heat in to try and see if that helps, but not really.
Have you had it like that before?
Not like that, no.
No. Strange, isn't it? Let me just see who the duty doctor is a minute. Oh, Hello. Oh, here he is. Come on in. This is Hello. Hello. This is Bridget Callahan, who I see every week for a leg ulcer.
OK, so your knee swelled up and was
It was
painful.
literally sort of out here. Couldn't walk properly. And that's when it sort of basically started, Monday night, Tuesday morning. And it was literally round here. And the pain was pulling from here and across underneath there.
OK. The swelling has come down somewhat, but the pain hasn't got any better?
Not really, no.
OK. Have you had problems with the knee before?
Only since the accident.
OK.
And an RTA.
Do you mind if we, while we're talking about it, we get you up on the bed? OK, so you've got naproxen and cocodamol on your prescription on a regular basis?
Yes.
I'm going to press in a few different places.
OK. Yeah. Sorry.
So what I want to be sure is that it's a problem with the knee joint and not a problem with the other structures around it, like the blood vessels or the muscles. I'm fairly confident from examining it that it's a problem with the knee joint.
Right.
We don't want to miss blood clots or those kind of things, or skin infections, and I don't think there's any evidence to suggest one of those things. The knee cap almost seems to be floating, so it's quite bouncy, which suggests there's some fluid underneath it, in and around the joint, which would suggest perhaps a flare-up of arthritis, and it's common to get arthritis in joints where you've had broken bones around it. I guess we need to try and get you a bit more comfortable.
Yeah.
A simple change is go from 3 to 4 times a day for the cocodamol, squeeze in an extra dose, taking it 4 times a day. Having your leg elevated, resting up, making sure your leg is at least as high as your hips, ice it. So anything from the freezer, wrapped in a tea towel so you don't get an ice burn. 15 minutes on there may be quite soothing and bring down some of the inflammation. These things tend to flare up and then settle down. If it's not settling down over the course of the next week or so, we need to have another look at it. Yeah, absolutely. OK. I'll leave this here and I'll leave you guys to it.
Thank you.
Nice
Thank you very
to
much.
meet
Very much.
OK.
Thank you.
And I'll just scribble on notes on there.
Thank you very much. You want to stay there?
All right, I don't
Might as
mind.
well, aren't you? Now you're there.
Yes, it's leaking off.
I can see it's leaking, yeah. Which you don't often leak, do you? So something's going on.
Yeah, because I had a bath this morning to make sure it was clean.
Yeah. Looking pink around the edges, isn't it? I was wondering if I ought to do a swab while you're here.
Is it normal for the sort of purple to keep coming up as it is, or is that just...
The what?
Sort of the coloration.
The coloration. This is circulation, isn't it? Yeah. Let me just take a swab on that as well.
No, it's getting in the stage at night, it gets so hot.
Yeah. We're going to be high enough, is it, Bridget? Or...
I think it probably would, yeah.
Let me help you down, all right?
Yeah.
Oops. Hop along. Let's hope it all settles down now.
Well, hopefully, yeah.
Hopefully, yeah. Open the door for you.
Yeah.
Take it steady then.
We'll try.
Try. You haven't got much choice with that knee, have you?
No. All right then.
All right, take care
Thanks,
then. Bye-bye.
Come on in. Thank you. Hi, have a seat. How are you doing?
Yeah, I had ringing in my ears, so I know what's caused it. It was a band practice a few months ago.
Was it? And your hearing hasn't been affected since then?
I haven't really noticed it being affected.
So it's just this ringing. And is it on both sides?
Yeah, I don't know, that's a good question, actually. I haven't really tested to see if it's
But
on both
it's
sides.
not obviously just on one side, for
Yeah.
instance. It seems to be on both
Yeah, it
sides.
seems to be, yeah.
And you haven't noticed any dizziness or falling over or any other symptom? It's just this annoying ringing?
Yeah.
Can I have a little look in?
Yeah, go for it.
Have you had any thoughts about what's going on or looked it up
I
online?
looked it online, thought it was tinnitus or something like that.
Yeah.
And, it doesn't really look positive for getting rid of it.
No pain at all? Do you put anything in your ears, like cotton buds or...?
Yeah, cotton buds.
Yeah?
Yeah.
Okay. What I can see is that both the eardrums are mildly indrawn, and they should be nice and flat.
Yeah.
And sometimes, if the pressure's not right on the inside, it can suck the eardrum in.
Okay.
And what we want to try and do is get your eardrum nice and flat.
Okay.
Now, whether this is going to change the tinnitus is not clear.
Okay.
Because sometimes tinnitus, unfortunately, is just a condition, as you've looked online, where you get this annoying ringing. So in the first instance, let's try some nose drops of steroid.
Yeah, okay.
And the reason they're good is because they help open up the tube that goes from the back of your throat and nose into the ears, the eustachian tube.
Okay.
And you know about when you go on an aeroplane and you pop your ears?
Yeah.
I want you to do that loads.
Okay.
Second, these cotton buds can push in the eardrum, and that can be part of it. So try and avoid those. There's no wax at all.
Yeah.
And olive oil probably is a good way of clearing any wax if you've got that. But there's nothing from the outside to see other than the mild indrawing.
Okay.
It's certainly not bad,
Yeah.
but I think this would be a good strategy to try and help everything that we can do.
Okay, yeah, sounds good.
The other thing is that with no hearing loss and no dizziness, and it's just on both sides, it probably is just sound-related, tinnitus.
Yeah.
So hopefully we can make some progress with the spray.
Okay.
But if it's not settling down,
Yeah.
then the other thing is just to read up about distraction techniques.
Okay.
I don't know if you've read about white noise or putting some earphones on, because sometimes you can just train your brain out of hearing those annoying ringing noises.
Okay.
Cheers then. Hope that does the trick.
I hope so.
Cheers. So what's been going on?
So Eden has had a bit of a rash for a while, about 8 weeks in total.
Oh, right.
It didn't seem to be bothering her at first, but now it seems to be getting a bit itchy.
Okay.
She's been starting to itch the one on her legs, and then it's been getting a bit more, like,
So it has got a
angry
bit
looking.
worse there, has it?
Yeah.
Yeah.
So started off with a patch on this arm,
Yeah.
which has actually improved slightly with the sun, I guess,
Good.
as you'd expect.
Hello.
And that patch was there for a couple of weeks, and then sort of there was a bit more on this arm.
Yeah.
And then it came onto one of her legs.
So she's fine at eating and drinking normally?
Yeah, I
and
mean, she's
Hello.
teething at the moment, so she's had a bit of problem with that, and she had a bit of a snotty nose
Yeah.
last week, but generally she's very
been
well
okay.
in herself.
Can I just take your temperature? Yeah, you're fine, aren't you? Apart from this annoying rash. Well, it's a little tricky to say what's causing it. I expect that this is just a little bit of infantile eczema, and that means dry skin linked to being a baby.
Yeah.
So 2 things I'm going to try, some good moisturiser and just a tiny, tiny dose of steroid to see if that settles it down. Does that sound okay?
Yeah, that sounds perfect.
It's very mild, and we shouldn't be needing to use that for very long, sort of up to 5 days, maybe. So if there's any ongoing problems, do pop back to see her.
Lovely, thank you.
Good. Hopefully that'll do the trick.
Brilliant, thanks very much. Get you
Great.
sorted.
Nice to see you.
Say bye-bye.
You're right with the door.
Oh, thank you.
Cheers, then.
Thanks, bye.
Bye.
What's been happening?
So, on Sunday night, I started feeling really unwell, and then started feeling really shivery, and then tonsils, massive.
Okay.
Temperature was like 38.8, 38.9.
Oh, right.
Every time I've had tonsillitis before, I've taken penicillin V.
Okay.
And I had some of that at home, so I did start it, even though I know I really wasn't meant to. But I couldn't come off work, so I had to start it.
Okay, so how many days worth have you had?
I literally just started, like, yesterday.
Right, okay. So no loud singing, shouting?
Not particularly. I am quite a loud person.
This must be killing you then.
I know, yeah.
Have you had any painkillers in the last few hours?
No, actually, I haven't, so hopefully... Like, the pain is definitely not as bad as it was.
Okay.
I work in a hospital, so one of the doctors checked me over on Monday, and he said it looked like viral. He didn't think it was bacterial, but he said there'd be no harm in taking some antibiotics anyway.
Which doctor said that to you?
I know.
Bad doctor?
Bad doctor.
Okay. Deep breath in. They are definitely swollen. They're certainly not full of pus or anything like that. Particularly sore?
They were, but they're much better
Not
today.
too bad, yeah. Okay.
They were massive.
Are your ears okay? Any earache?
Ears are sore, all up my neck is sore.
Have a stand up for me a second.
It's driving me slightly mad.
Any pain here at all?
Not particularly, no.
So your ears are really red.
Okay.
So again, that would fit more with a viral
Yeah.
sort of A little bit red, but your eardrums are nice and clear and shiny. If you started the penicillin, then we probably need to finish that, really, because if it was bacterial, which I'm not convinced that it is, it could just come back and be bigger and stronger and nastier. OK, I need to get this signed by the duty doctor, so if you have a seat in the waiting room and I'll bring that out to you when it's signed. All right?
Thank you so much.
You're all right. Nice to meet you.
You too.